we as one of who's doing plasmapheresis, maybe I done in certain years up to 400 procedures per year of plasma exchange. We faced a lot of cases. We find a lot of problems. We are following these cases now. We have a lot of good, nice events and improvements, and we have a lot also of failures. We try to improve the sessions for plasmapheresis as much as we can and to introduce it as much as we can. I heard a lot from you today. I really I got a lot of information, and I want to help you and some exchange of some informations with you regarding plasmapheresis. Spectra Optia is a full system. This is our new system. I know I saw a lot of pictures of Spectra machine, a very nice Spectra machine, which all of us who worked in plasmapheresis like this machine. But let us be informed that this machine will not stay forever with us. We have a newcomer. It's not a newcomer. It works for more than 4 years, with making some much easier for the pediatrics to solve a problem for the pediatrics, for the time, for the patients who are coming to have hypotension at a certain time, to introduce a bolus technology which you can give your patient 100 mLs in 30 minutes to improve the situation. It can give you a safety box to improve a lot of features and make your life easier. Patient blood is processed. This is a centrifugal separation, not a membrane, of course, and the old technology is also a centrifugal. This is a centrifugal separation, which from our point of view offers a lot of benefits compared to membrane. Centrifugal force separates the components of the blood. Then several options could be done, either to exchange this component, either to deplete this component, either to collect this component. So centrifugal, depending on 3 issues, which you can exchange the component, deplete the component, or collect this component if needed. Step 1, whole blood is processed. Centrifuge the whole blood. You will see the plasma, the red cells, and then you can get the waste out, and you can substitute the albumin or fresh frozen plasma according to the indication, and mix the blood and return it back to your patient. Exchange procedure, we have therapeutic plasma exchange. We have also therapeutic plasma exchange with single needle if you have a difficulty in access. We have also a red cell exchange, or we can have a secondary plasma device outside this device, which we can make column adsorption for certain antibodies or cholesterol. For collection procedures, we can collect on this machine a mononuclear cell collections. We can collect granulocyte collection, or even we can collect platelet collection starting from this year. Depletion procedure is to get rid of white blood cell, to get a platelet depletion, or at last we can do bone marrow processing to squeeze the bone marrow and get rid of extra plasma or extra debris in the bone marrow. This is a very simple machine you have to start. I saw a very nice machine for the oldest IBM represented by Dr. Osama. It was very nice. This is the newest one, which is coming in a very simple form, very easily. It offers a graphical user interface, simple, high resolution. Then you can get an IV pole. You can see the cassette tray, which you can put it in one step. You not miss a lot. It's much more easier. Just all the lines are loaded inside one cassette. Just put it in one step. Then we have a centrifuge. You can also have a viewport here, which you can see what is going inside in a very clear way with the help of a camera, which is taking more than 25 pictures per second to adjust the interface. Optical interface detection system performs real-time interface monitoring, interpretation, and adjustment. You can adjust this interface, minimize operator intervention without limiting operator control. Also minimize need for manual adjustment of interface, allows operator to control interface as desired, reduce operator training time. Maybe you have a ready operator within 1 or 2 days to start to operate on this machine, which was very difficult in the past. We need an operator sitting for more than 2 weeks or even until he become trained. Also, we have re-establishing the interfaces very quickly in this if access issues are controlled. This is this is the automated interface management system, how it manages how many plasma or blood is coming, how many plasma is getting outside, how many red cells is coming back, how much substitution fluids is added in a very controlled interface, and this is an adjustment every second, 25 times by the camera to adjust the pump speeds and everything in this automated machine. We offer also a high resolution. This machine offers a very high resolution color touch screen, multiple languages, simple touch screen with a lot of drawings on it to make it much more easier if some operators don't know English very well. Important procedure information presented all at once, use of graphics and text. This you can see the follow-up. This is once we started, this icon is for selecting the procedure, then prepare the tubing set, then prepare the procedure. Every step there is an icon which is coming, giving you that you can start. You can have also the choices in the other side, either to use a therapeutic plasma exchange or mononuclear cells, or to come to an automated red cell exchange, which is very important maybe in sickle cell anemia cases, and it will be tried also in some thalassaemic patients. You can see the preparing the tubing set in every instruction. In every step there is a clear instruction, and what is when you get the disposable, the sterile disposable, you can give you the landmarks step by step what you have to do at every step to remind you. This is also a clear indication for the lines, what to close, when the line, you should close this line. This is a clear instruction to close this line, to open this line, and give you an instruction step by step. And also this is a very nice cassette for this, that you can load all the disposable in one time without 0% of errors, 0 error %. Also there is, when you put the AC, when you put the saline, everything is qualified. This is a machine which you can deliver it to everywhere. It is easy to transport and compact size, stable, collapsible monitor IV pool. You can also, at the end of the run, you can print all the data. You can get all the data, what has happened during the procedure. How much volume you collect, how much volume you replaced, the amount of AC fluid used mixed with the blood. Is it the compensation is 100%? The procedure is completed at what is done. You can keep it in a file or keep it in a computer, or to make the success what happened in every session you have done. Either to give also seal safe system which you can able to close the bags at every time it can be supplied with the machine as a sealer within this machine to close your bags at the end of the procedure. This is, as you see, alarm screen navigation, which can give you the alarm with a full description for any problem which happens during the procedure and what is the suggested interaction you can do. This is simply the Optia Exchange Set. It is a very simple way, connectors from cassette, the channels, this cassette loading all the tubes inside it, and you can see all the flow paths inside it. If you can need a bag, if you need a replacement spikes, the replacement spike. Offering also maybe a solution for pediatric patient. We have a machine now, a continuous flow with extracorporeal volume for both therapeutic plasma exchange and RBC's exchange is a steady 185 mLs. Like Dr. Osama said, we will avoid the hypovolemic attacks or hypervolemic attacks for the patient. So it is a stable 185 mLs for plasma. This offers more safety and patient tolerance. Operate pediatric procedures more safely. You can help for the pediatric patient, and you can encourage it to use it even before IVIG. Multi-procedures, 3 types of Optia set to operate 9 different procedures. We can work TBE. We have also TBE single needle if there is a problem for the access for this. We can do also red blood cell exchange. We can go with mononuclear site collection and other polymorphonuclear cells collections and platelet apharesis or platelet collection. Therapeutic plasma exchange, patient plasma is replaced with replacement fluid. I think this was discussed a lot in this session today. And just only to give you an information that the machine collects all these informations about the height of the patient, the weight of the patient, to calculate the total blood volume, to calculate what is the expected volume. I showed today a columns of if you change half of the plasma volume, we will remove 39%. If we removed one plasma volume, we are nearby 70%. If we removed 1.5 plasma volume, we are nearly 80% and 85% for 2 plasma volume. So the machine is always giving you a suggestion for 1.5 plasma volume otherwise indicated, in which case we can exchange more than 75 from the disease mediators in this procedure. You can get also a calculation of the saline albumin, what is expected from you. This is, we know that in the form in Egypt we have the 20% concentration of albumin. It is give you an instruction about to use the 4% albumin concentration which is expected, which is preferred, and we can, all of the doctors know how to dilute this albumin in this saline and how we can use in the fluid balance to adjust it, the fluid balance for the patient between 150 up to 75 according if he need hypovolemic or hypervolemic. Also, we introduce in this machine a single needle if there is a problem in the vascular access, to mix both of them in one needle in a very simple article, just a very simple device. You can add it to the disposable, and we can exchange plasma exchange from a dual needle to a single needle in a very short time in a proper way. Also, we introduced this year a red cell exchange. We're really interested to make something like a study in Egypt about sickle cell anemia, if it is present, if it is treated with an automated red cell exchange machine, what is the benefit for the patient, if we can indicate patient with thalassemia, and the company is really ready to support a study done for sickle cell anemia or thalassemia over this fully automated machine in Egypt. Indication for red cell exchange, as you know, of course, characterized by defective, infective, or excessive RBCs. Procedure goals to remove the defective or excessive RBCs, infuse replacement fluid, change patient hematocrit, maintain fluid, and also for the famous sickle cell anemia is to substitute hemoglobin S with the hemoglobin A by a certain percent. Replacement fluids, we can use the donor RBCs inside the machine in an automated way. Also, we can give him non-cellular fluids as a compensation for plasma or other constituents lost. You can manage also here, you can see a fluid data which you can follow up. If you are exchanging, the balance is how much percent. If you are depleting something which you don't compensate, or either you deplete platelets with some compensation of fluid, this is give you the tools to manage with this. Something regarding the mononuclear cell collection, it is now beginning a very brand used for stem cell collections in the biggest bone marrow transplantation centers in Egypt. It is completely automated system. You can use the interface and the automated camera to control the procedure. I would like at the end not to enter in this granulocyte depletion, which we are preparing for patients with acute leukocytosis in acute leukemias or something like this. We are doing some procedures in this. And this cell separation chamber and the whole processing, and also we are doing platelet depletion on it. This is all regarding the Optia machine. I try to be short as possible. I would like to thank Dr. Amr again and University of Atlanta for this support and this help. Thank you very much.
Thank you.